One way that I can articulate to my patients on how to improve their diet and why diet matters with respect to lubricating their joints and body and fascia and etc. is that I say, okay, pretend you had a bowl of sugar water here and we put our hands in it and we let our hands dry. Then try to bring your hands together and touch them and try to pull them apart. It's nice and sticky. Well, that's the exact same that your connective tissue is going to be if your diet is high in sugars, refined carbohydrates, and inflammatory foods. If we have a bowl of olive oil or ghee and we put our hands in and then again we let it dry and we kind of rub it around, it's nice and lubricated. So that's why we encourage an anti-inflammatory diet, high in good fats, and really high in greens and vegetables and not processed food.
Hey friends, it's Mike Mutzel here with highintensityhealth.com. Thanks for tuning back into another episode. Today we're live with my friend Dr. Shalini Bhat, and we're going to talk all about fascia. And this, in my eyes, Shalini, and you can kind of reinforce this, I kind of view fascia, and we were talking about this offline, similar to how the microbiome was viewed maybe in like 2001, 2002. Like, we know it's there. We don't really know, we can't quantify it or like give a number to it or see it relatively, but we know it's doing something. And we know fascia is kind of like that in that same realm. But talk a little bit maybe about that study that recently came out in November of 2016, like reinforcing what fascia is doing for our musculoskeletal system.
Yeah. So it's really cool because just like you said, we didn't know it existed. And in fact, even in my cadaver labs when I was back in school, we would be dissecting out the fascia to look at the underneath, which is the muscle. Ooh, this is so exciting. What's the origin and insertion? And we were just kind of scraping it off. And as anyone knows, just to dive back, kind of what is fascia? If anyone has like, a steak or a piece of meat, it's that white film that you'd kind of pull off the meat, right? And same thing in a dissection lab. So we sort of knew it was kind of there, but we'd all dissected away. And what we didn't realize is there are these really powerful connections throughout the whole body, and fascial sleeves can run from the tips of your heels all the way to the top of your head in one continuous track, wow, so to speak. So similar to the microbiome, we're only now starting to map, various bacteria and, our viral biome and our bacterial biome. So now, same thing with fascia, we're mapping the tracks, or it was done now several years ago, but to see where those tracks go and how we functionally are able to move around using those fascia lines.
Which is pretty amazing. And what inspired me to have this discussion with you was, I think we're having lunch and you were talking about where you can tell if someone has metabolic dysregulation by manual manipulation. You were like, oh my gosh, yeah, this person, they're going to need a lot of work before we correct these imbalances. So let's talk about as a practitioner, how you can tell someone's state of musculoskeletal health through that touch.
Yeah, so it's really interesting having done, a musculoskeletal practice, as you say. I've been able to be hands-on with different patients, and over the years, that's sort of what led me to functional medicine was how come these certain patients, you work on them, you rehydrate their tissues, you're doing acupuncture, the neuromodulation of their nervous system is there and their back, but they keep going back to this same pattern. Why, right? So I started diving deeper, and that's how I found functional medicine. But now that I, have this manual practice and functional medicine, you can sort of see the minute I touch someone, I'm like, okay, there's a lot of metabolic stuff here, or okay, yeah, this can move. And the reason I say that is when I start putting my hands on someone and I'm kind of moving their fascial sleeves or tracks or however you want to call it around and increasing their mobility, if they're responding fairly quickly, you can tell that the cell health of the fascia is healthy, and it's hydrated, and they've got quick responses. Whereas when somebody has that metabolic dysregulation, they sort of still have this sticky quality to their movements, to their, just palpating them, you can feel the tissue's really stuck and you're not really getting where you should be getting in a healthy individual. So this sort of, links back with, fat versus sugar.
Yeah, so this metabolic dysregulation causes, and you corrected me offline, musculoskeletal is kind of passé. So what would we call it, if in manual therapy, when we get massage or chiropractic or osteopathic or physiotherapy, right? This used to be called musculoskeletal like treatment. You said neurofascial?
Yeah, so neurofascial skeletal really, or neurofascia. It's kind of where the new term is going, because musculoskeletal is just old. So we used to think of all of our bones just stacked on each other, as Tom Myers would say, like a house, like bricks, and they're just laying. If you even look at a skeleton hanging, we think, oh, just our muscles and our bones are sitting on top of each other. But what's really neat is fascia encompasses every single part of our body. It's a real three-dimensional web and structure that goes throughout the body, and our bones are actually floating within this fascial model, as are our muscles.
Right.
So
really interesting. And so because it's all connected, and I guess it's a great point to kind of hold that thought and talk about the mesentery. And this is why I think a lot of people should be excited about fascia and gut health, because everything's connected, right? So if you have inflammation here and the mesentery, and I would love for you to define what the mesentery is, but let me just kind of preface that statement, is it's all connected, right? So you have gut inflammation, you have lymphocyte infiltration, all these inflammatory cells around the mesentery, then you have achy shoulders, joints, and all this. And so, we know that osteoarthritis was traditionally thought of like, oh, you're overweight, so there's too much pressure on your knees. But we now know it's a metabolic disease, right? And so people, when they lose weight, the osteoarthritis in the hands improves. They're not walking on their hands. How is it? Well, their whole metabolic system is becoming more regulated. So let's talk about this, how it's all connected, and particularly with the gut.
So, we were sort of touching upon that new study that came out in November 2016. So this is super recent stuff that they're actually saying the mesentery is now an organ. So what is an organ? It's a self-contained, vital organ with an actual function, right? So we think of the mesentery, it's just a continuous sheet of fascia that holds our entire, basically, gut, right from our small intestine, large intestine, and it kind of floats and holds it up in space, so that, obviously when we stand up and gravity pulls down, our organs don't all fall to our pelvis, right? So it's kind of suspended there. But, they finally, now the study came out and said, hey, this is actually an organ. So even, Grey's Anatomy textbooks for medical school, only just recently in the fall did they start acknowledging that the mesentery was a whole organ on its own,
So an organ, much like the liver or the kidney or the microbiome, which is now a new organ, right? That's being elucidated. So it's really funny how we want to see, feel, and touch something in order for it to be defined as something. Like the microbiome, oh, it's just stuff and poop and whatever, it doesn't do anything. Now we know it's really important. If you have imbalanced gut bugs, you can have depression, anxiety, whatever else systemically. So imbalances in this fascia can kind of ricochet throughout the systemic.
Yeah, absolutely. Well, I even think again, having treated people manually, and having, done deep work in people's abdomens where you can sort of feel this, dysfunction or tightness happening, it kind of, you link back and you think, hey, okay, in vivo, it are these little tight pockets of fascia holding in bad bacteria or something. Even if you just think of movement, things can't move because there might be little tight pockets in different areas, right? So you need that manual work as well to sort of open up, the kind of where they're living, right? Not to kind of suffocate them into little pockets, right? So you think of diverticulosis is very common nowadays as well. Is there a component of that in it as well?
Well, and gastrointestinal adhesions, so that's kind of a big thing too. I was just talking with Sachin and Deepa, right? And so a lot of people don't think about that the gut can kind of adhere and create blockages, and that's exactly, you're exactly right, And I think you and I spoke previously. I was telling you about an analogy I give to my patients, which is, if their diet is high in sugar and versus, maybe higher in fat, and how joints don't lubricate on sugar water, but they would lubricate on good fats, right? So if you think of, or connective tissue, I should say, in general. So if you have, a bowl full of sugar water and you put both of your hands in there, and then you leave your hands out to dry, and then you bring them together, they're nice and sticky. If you had a bowl of just olive oil, let's say, and put your hands in it, and you went like this, your hands are gonna smoothly, move against each other. So I think, coming back to your adhesions, I think not only are there manual adhesions happening, I think emotions cause contracted fascia, especially in the gut. In Chinese medicine, our hip flexor holds our anger. So our hip flexor is traveling right through there as well. And then we've got, dietary things that are also creating these adhesions in the gut as well. So many questions come up, and the one that came up the most rapidly in my mind was about anterior pelvic tilt. And so we know that people have like tight hamstrings and imbalanced hip flexors, a lot of sitting and so forth, but you bring up this emotional connection in Chinese medicine. So if someone's really harboring a lot of anger, maybe past trauma, and has that anterior pelvic tilt, do you think more emotional stuff now that you kind of understand this?
I don't think more of anything, because I'm really anti-thinking linear. So I really now with functional medicine know that there's a little bit of everything always. But for sure, if I see someone like that, and actually in my practice from seeing those types of, pelvic orientations, I ask the person, and a lot of the time in the history, there is some, resentment in their past or anger, or, even women who might have had a lot of infertility issues and they had a lot of, pelvic, from the hormones and the needles and, a lot of pelvic invasion type of diagnostic things.
C-section maybe.
Yeah, or even just the exploration to figure out their infertility and stuff. They've had a lot of stuff happen there, and their hip flexors are so tight, right? So it runs along with, a lot of emotional stuff, I do find,
And it's not really surprising when you think about it, because you're like, it's like a protective mechanism of the body saying, hey, what's going on, guys? Chill out, trying to protect it.
Yeah.
And along those lines, I know you and I are both friends with Dr. David Brady, who's a past podcast guest, and he's talked about like how trauma, has maybe gone too far, like the adaptive response to trauma, like early abuse, and that protective and kind of harboring emotional responses and memory within a certain part of the body can lead to things like fibromyalgia and allodynia and hyperperception to pain.
Absolutely.
So there's that whole connection. Any thoughts there for people that do have experienced some of those?
It's like with anything with the brain, right? It's like if you picture that beautiful picture of the cerebellum and how, the sensory map, right? As soon as something happens, we have a certain area of our body dedicated to a certain portion of that sensory map, right? As soon as something happens to the body, that sensory area on the brain becomes bigger, right? So that awareness sort of, so to speak, right? So I'm with you on that yeah, for sure, as soon as something happens, your brain immediately rewires to say, okay, I gotta be a little more aware of this part. So for example, if a patient hurts their back, immediately this much more area is devoted to their back. So even if you just like tap them, they're like, right? Of course. Whereas before, if you brushed by their back, they wouldn't notice.
Right.
So there really is something to be said, whether it's emotional, whether it's physical, because even when it is in your mind, we can have these physiological responses. So, Dr. Andrew Weil writes in his book about picturing a lemon and biting into a lemon. You all of a sudden start salivating, right? So it's a non-physical change, but it creates a physiological response, right? So I think on both ends of the spectrum, you have that. Like, yes, it is rewiring and there's something going on, to create more perception to that area for sure.
That's a really good analogy, like that cephalic phase of digestion, that you were referring to, but there's also that emotional connection, right? So if we have these bad memories, those can affect other parts of our body that maybe we're not as conscious or aware of.
Definitely.
Which is really interesting. So, all right, I don't want to trash on chiropractic because my wife's a chiropractor as well, right?
Oh, yeah.
And so she does a lot of the metabolic things and nutritional counseling and things like that. But there are just a lot of traditional chiropractors out there and traditional osteopathic or massage therapists who just treat, the shoulder or the elbow or the back and whatever and send you on your way. And in your eyes, considering that, this fascia is an organ now, we understand it's connected to blood sugar and inflammation. Are those patients going to really get where they need to be, like from a musculoskeletal health standpoint?
So, good question. Okay. So I sort of think of it this way. As I mentioned earlier, things are linear. So it's to no fault of any specific, physician's background of how they approach things. But I think it's really important that we start to look at everything as a three-dimensional in vivo body and model, where, maybe chiropractors, they just are looking at the spine and manipulation. Osteopaths are maybe just looking more at the soft tissues and the organs. Maybe physios are looking more to just the gross musculature and, kind of just the physical aspect of the body. And I think GPs are doing the same thing. They're breaking you up into just one part or one piece. Same with specialists. They're breaking you up into one part and one piece. And I think we all need to zoom out So everyone's so far zoomed in, they can't even see the whole person in front of them, and how that person's every single system is interconnecting and working. So I think, to answer your question, every practitioner has the best of intentions to get that person better, but do I think that by zooming in and creating sort of your own practice model, that a patient can come into your own practice model? I don't think that works as well as, the physician approaching the patient in what's going on with the patient and creating, like functional medicine is, right? It's about the patient rather than the practice.
Right.
For an example, a chiropractor would say, I have 5 rooms. I want to use each one for 5 minutes. Yeah. I can book 5 patients right now. Oh, your back's hurting. I'll just manipulate your whole spine. It's like there's so much more to why their back might be hurting or what the root cause is, as we know with anything else.
Right. That's a really good point, is as Jeff Bland has talked about for a long time, we need that 50,000 foot view. Like if you're flying a plane, 45,000. So that's really what we're kind of looking for and striving for. So yeah, we don't want to say that anyone's doing anything wrong. I think like most people do the best with what the information that they have, and both with practitioners, right?
Yeah.
But let's go back a little bit. So we have mutual friends that are in treating athletes and so forth. And I just caught up with Dr. Kate Shanahan, the author of Deep Nutrition. And so she's worked a lot with the LA Lakers. And one of the things that she talks about, it's very interesting what you talked about with your hands with sugar. And I love that analogy, right? Where she says, the athletes that are eating the more real food, traditional food style diet, lower in carbohydrate, higher in healthy fats, they tend to recover better, and specifically the older athletes, they love it because their recovery is not as good as like the 34-year-old is not recovering at the same rate as a 23-year-old athlete, right? So let's talk about the importance of like a real food diet and the fat, and what does that look like? Because I know there's so much individuality. Like for example, you don't do really well on a ketogenic style diet, right? So how is a diet important, and how do you individualize that in your practice?
Well, so what I would say about females anyways is just about my practice specifically, is that it's really important that when working with females is that you respect that there's a cycle. Right, so from day 1 of her cycle all the way till the end, everything is changing between hormones, neurotransmitters, gut health, everything, right? So there are different reasons why a woman might change the way she's eating throughout the cycle. I agree with a lower carbohydrate diet for sure, and I agree totally with a whole foods based diet, and I think that's where we all need to be focusing on. In my practice, I definitely try to, with my musculoskeletal practice, is to encourage everyone to be on more of an anti-inflammatory diet. So we try to use the add-in method, because I feel like as soon as you say can't, people are like, oh my God, I can't wait to get home and have my whatever you told me not to eat. So, or that'll make them start tomorrow or something. So adding in greens. Right, so like if you say to someone you need to eat greens at least twice a day, well, now they've got to kind of make their meal around that, right? So they've got to have good fats, every single day. They've got to have water, and we also kind of work a lot with the alkaline
pH and so forth.
Exactly, yeah.
Is that first morning urine, or how do you?
We usually do. Well, if I have a patient kind of just starting with me, I'll get them to do it, more regularly for the first week, so they can kind of see, and they're seeing, we use these little pH strips that are yellow, and they're like, it's staying yellow. Is it supposed to turn green? Yeah. Right. So it takes a couple days for them to actually, alkalinize, and then they're noticing the differences from there. But I definitely agree with a higher fat in a whole foods,
style diet.
Style
right.
diet,
Don't go too overboard with it and get neurotic. But
exactly. And you and I were speaking about, the preparations of various things. So, we just did this podcast on ghee, but going back to India, in India, how they would eat, for example, grains or legumes would be to soak and then sprout and ferment. So it has that little extra bit of digestibility. But again, you look back and say, genetics in India, they have the genes to also, and probably the microbiome to break it down. Yeah, right. Whereas in North America, we just grind everything, and of course, everything when it's ground, it's going to increase your blood sugar.
Right. That's a really good point.
So stone ground anything, right?
Yeah. So for folks listening right now when they're driving or walking their dog or whatever, they can't see, but we did make ghee. And so below the YouTube video, on this video, we'll have that demonstration. And so that was really fun that we did that. So thanks for sharing that.
Yeah.
But going back, I liked how you spoke to like the seasonality or the cyclical nature of female health, right? And I think a lot of practitioners and women in general are trying to optimize that health, and they notice changes in their mid to late 40s and so on. So what does that kind of look like? Is there regions of the cycle where a little bit more blood sugar is okay? I mean, having more carbohydrates that you recommend, or?
Well, I think, like in nature, hopefully after ovulation, the woman is sort of, expecting to carry a child, right? So yeah, their body, they would be kind of wanting more carbohydrates in the second part of their cycle because their body's smart and saying, hey, you know what, beef up a little bit because we might have this extra, human to feed. But, it's also to say if someone on the flip side of that, if someone's not trying to conceive, that might be the time where they do kind of want to lean out a little bit because they'd be more susceptible to putting on weight or holding water weight and all that kind of thing. So you would want to stay away from carbs, whereas at the beginning part of their cycle they can probably handle them better. And that's because the serotonin is going to lower down, gut motility is going to decrease towards the end of their cycle before their period. So that's when they might not be able to have those foods as well, but they might, their physiology might want it because they're preparing for a child.
That's a really good tip. I have never heard that before, but that makes a lot of sense. So we've talked about nutritional ketosis before, and the reason why that comes up in the context of fascia is because the anti-inflammatory nature of being on a ketogenic style diet, right? Like increased heart rate variability and all these beneficial changes to the epigenome. Have you found, well, let's talk about your experience with the ketogenic style diet, and then also like with women, like some women love the keto diet, others don't, and then the cyclical nature of it, like with hormonal issues. So have you noticed any anecdotal feedback there?
I think with going straight keto, I think it's very important that women for adrenal health anyways are definitely having, carbs at certain times because, just the responsibilities of a woman and generally, mom running around, work, like all that kind of stuff, their adrenals are already a little bit primed. So if then we're taking them completely off of carbs, I do believe that they should cycle in carbs at a certain point. It shouldn't be straight keto. That being said, of course, there's, different, if we're talking about cancer or if we're talking about very specific populations, yes, I do think there should be, strict keto. But I do think it's important to, have like once a week or
more flexible.
Be a bit more flexible carb cycling. For sure.
Yeah, I think that should be with anyone, right? I mean, that's just nature. If there was apples around or you stumbled upon a fruit tree, you're going to probably eat it and not say, oh, no. Sorry, friends, we're in ketosis. We can't have these blueberries. Kind of thing, right? So it's really interesting. But let's talk about your specific experience being.
My specific experience. I think so. I did keto for pure keto for about a month, but I think my adrenals were in a really bad place when I did it. I also think, from having done a stool test afterwards, I think my microbiome was not in a good place either. So I have hopes of trying it again, but I haven't gone back. It was just a bad time when I did it, and I know I did not do well on it. I was definitely holding weight and I was not lean.
Interesting.
But
so you're mostly a vegetarian, right? And we didn't
talk. No, I'm not mostly a vegetarian. No.
I didn't know that. Okay, so you are Indian, so we didn't talk about that yet. We talked on the ghee video, so maybe there's some genetic issue or.
So I mean, Indian people and if you look at Dr. Diadamo's work, he would say all type A people, type A blood people have lower stomach acid in general. Back when I was introduced to betaine and I was like, is this supposed to do anything? And I would just take one after the other. Like I could take up to 13 and I was like, what? I don't feel anything, right? So I know, historically, Indians are generally lower in stomach acid anyways, but.
Interesting. So the higher protein doesn't really do well with you anyway, right?
Well, I think it's really important, and going back to the most boring, lame advice again, is, this lifestyle of eating meat very fast. So if you sit down to whatever the meal is, obviously chewing your food and all that kind of stuff, I think is really important because I always say digestion is like reading a book, right? Like if I was like, read this page in 3 seconds, you're gonna have no idea what it said, right? If I was like, here's 20 minutes, sit down, read this page, you're gonna be like, okay, I get it. You're gonna have digested what was on that page, right? And you'll be able to reiterate it to me. You know, food is just information. So I think it's very important that we actually give our bodies the time. So yes, we can take the stomach acid also, but that's important as well, you know, slowing down and digesting and chewing. And
that's a really good analogy. I think it will hit home for people because they call it like Reader's Digest.
Yeah,
we use that same
so
word,
yeah.
but it's so funny. So I might have to borrow that analogy, Shalini. That's a really good one.
Yeah, definitely.
Yeah, and then the fascia one too. That was really good stuff.
Yeah.
So let's kind of talk about, I think your background in Pilates and things like that. So you do a lot of exercise and work on the fascia. So if someone comes in with chronic shoulder, elbow, tendonitis, what have you, we've kind of covered the diet, real food diet, lower carb, higher and healthy fats. What are we doing for the types of exercises?
Yeah, so we make sure to actually, the way we train, so it's Pilates based, but we're really looking at fascial sleeves and how to strengthen them. So a really great example is, one of the fascial sleeves. If you were to reach up and grab a bar and kind of hang from that bar, if you were to look at, the fascial musculature from the side, you'd see certain things are lining up, right? Like the oblique starts lining up with the serratus anterior to the rhomboid and all the way up, right? And so it kind of creates this link of strength, like hanging.
Yeah.
Do you know what I mean? When you hang from something,
I can visualize what you're talking about.
Yeah. So we basically work from those fascial lines and sleeves on creating mobility in the body versus working so much hypertrophy training. So, even one of the arm lines in anatomy trains, it can go from your thumb all the way to your chest. Sorry. So we might work the entire sleeve at the same time versus looking at an isolated kind of bicep exercise or an isolated tricep exercise. Those aren't really functional movements that would translate into everyday life and motion patterns.
Yeah, and traditionally, not to interrupt you, but most of these isolated movements, like if you overdo them, that's where you get hurt. I mean,
got it.
That's anytime I've gotten hurt is because I'm doing like a bicep curl or triceps or one-legged, some weird leg move, and it's just that it doesn't work. So we're talking about movements, not isolated like contraction of single muscles.
Exactly, yeah. And just to go back to fascial health, and you might want to use this too, motion is lotion, right, for your body in general. So as you're moving around, you're lubricating your body, right? You're increasing circulation, you're perfusing tissue, which, if you are just doing that one curl, you're not really getting the full benefit in the entire fascial sleeve per se. So that would be. So
it's good then, I infer from that, it's good to like really move the entire fascial sleeve.
Yeah, absolutely. Yeah.
Very interesting.
Yeah. And one of the things, that Tom Myers speaks about in this analogy of these bones sort of floating in this fascial bag, so to speak, is that one of the things we lose as we age is the elasticity of our fascia. So if you want to, sort of always have this nice elasticity to your tissue and movements and motions, you got to be doing bouncing or rebounding, or people do these vibration plates or all that, but really, bouncing on a medicine ball or Swiss ball, or in Pilates we do jump board. We put a plate at the bottom of the machine and we can jump lying on our backs. So it's, it's not bad for the joints or anything. But that's really important because it increases the elasticity of the tissue.
By draining and things?
No, by creating that tension.
Oh, I see.
Right? So by the fascia actually having to three-dimensionally kind of not contract and relax, but sort of, it creates that three-dimensional tensegrity model.
Interesting.
Yeah.
Okay. That's really, so be a kid again, go out and play and run around and jump.
Exactly, yeah. So if you look at kids, they want to bounce, they want to jump, right? They want to do all this, and their fascia is super elastic, right? Whereas we become too cool and we don't want to bounce and jump around.
Right. That is so true. I mean, if you see, obviously their ligaments are a little lax, I think, compared to us, but some of the things like my daughter takes these tumbles and falls skiing, and I'm like, oh my gosh, if that was me, we would be, that would really hurt, and they get up and it's like no big deal. So it's really kind of interesting. And even young athletes who are eating well and training well, you see, like, I love watching American football, and their knees take a weird, but some of them get up and like the same gut-wrenching like knee bend, and some people they're like back at it, other people are out for the season. So there's got to be that metabolic component.
Well, there is, and there's also a phenomenon called tissue creep. So tissue creep means, as you and I have been sitting here for however long, as soon as we reached 15 minutes, our tissues were at maximal stretch. So let's say we kind of were sitting there. You'll see if you watch this tape, we probably both readjusted around the 15-minute mark every single 15 minutes, because our tissues actually get into this creep, which means these tissues are stretching and stretching and stretching, and they're kind of all of a sudden like, hey, I'm really vulnerable, I'm at my max stretch right now, which means if both of us had a repetitive issue of doing that, and then we all of a sudden go to reach for something, that's where that elasticity is gone, because it's at maximal stretch, and that's exactly what you're saying. So a preloaded tissue then having an acute force in a football or whatever, that's going to be where you have your injury, versus someone who's rebounding and doing three-dimensional fascial training in addition to their hypertrophy training or their functional training, what football would be doing. They'll have more elasticity to it, because fascia really, yes, it encases the muscle, but it also goes straight into the intermuscular septums and right into the bones and all around the bones. So it really is the elasticity all over the body.
That's really amazing. It brought up, that little segment brought up a story where my buddy, he was reaching back and his jogger fell and then he tore his bicep. And it wasn't like a lot of load. I was like, well, come on, don't you have a better story than that, right? But it was like totally stretched, and there was just that small little load. Boom.
Yeah.
And I've done that in the car where I reach back to get something to I'm like, ow, that really hurt. But there wasn't much like tension.
Exactly.
So that's kind of that stretching.
So somehow you'd been pre-tensioning, whatever structure it was. And like you mentioned, the biceps, I was talking about the superficial arm line, it comes the whole way from your thumb right into your chest. So you might even be someone who's on your device a lot, doing a lot on your thumb. That's still loading the that same line, right?
Interesting.
So.
Or if you have like pronated shoulders, right, that can affect that whole line too.
Yes,
right?
yeah, exactly. Desk and devices.
So let's talk about, I'm a big fan of like Olympic lifting and weightlifting, and our listeners are too, but what should we be aware of when it comes to some of the movements, fascia associated with that, pros and cons? Yeah,
well, it's just important to, respect that it is an organ, it is there, and it's going to affect your function. So it's great to be doing all of that stuff, and it just is important to train also full body movements and doing functional movements, because what ends up happening in my patient population, for example, if you are doing just that hypertrophy training in certain muscle groups, if I give them a couple exercises of mine, they're so weak.
Yeah.
So weak. They're
can't even do it.
Embarrassed
too, like, gosh, I could squat 500 pounds.
Oh, right? And so, it's really, really important that you're cross-training and strengthening and respecting, again, that, fascia is three-dimensional and it's elastic and it's this living thing that you gotta, so body work, keeping your tissue hydrated, focusing on getting rid of the refined sugars and, processed foods, having some higher fat, just making sure you're having enough hydration, which, as you know, all water is not the same, right? We don't want to drink from plastic water bottles. We don't want to drink from the tap, really actually hydrating ourselves.
Speaking of hydration, so the lymphatic system kind of innervates all throughout the body. How connected is the lymphatic system to fascia? What do we know?
That's a good question. It's all running together, but I don't actually have a specific answer for you on that one. Yeah,
I was curious, in your background in Ayurveda and Indian medicine and things like that, I was kind of interested, because I know in Ayurvedic, the lymphatic and lymph stagnation is really a 5,000-year-old kind of thing, right? Yeah. Now we're also learning that this lymphatic system is really kind of the pivot between health and disease at some level, right? Lymphatic stagnation. So
yeah. I think that would go back to even just the adhesions in fascia, right? Because we need to remember everything's running within that sleeve. So there's nerves, artery, veins, lymphatics, and they're all going through. If they're not sliding well or they're not being able to move within that sleeve, I can imagine there's lots of stagnation, right? Just like we talked about in the gut.
Yeah, interesting. Let's kind of finish up. So do you have any patients that you can think of, like not their first name obviously, but just stories where someone comes in, they're really stiff, they have like multiple musculoskeletal issues, and then you kind of work on both. the exercise, manual work, but also the diet, and then they're more lubricated, things are working?
Absolutely, yeah, absolutely. A lot of the success in anything comes from the patient, and that's one of my biggest jobs, is empowering the patient to understand that they're the ones making all these changes. So you're sort of giving them the tools and saying, hey, these exercises or movements or motions or things you can do are how it's going to make your body move better. These foods to eat is how it's metabolically going to make your tissues healthier, and maybe through the supplements as well, and manual work, right? So we're always trying to perfuse the tissue. We want to wake up areas that are kind of asleep. We want to inhibit areas that are overworked, and then definitely get through the metabolism and diet as well.
Yeah, love it. So we now know about acupuncture and kind of like how acupuncture works and things, and the meridian system in Chinese medicine. Is part of that meridian system connected to fascia, and does acupuncture affect fascia?
Absolutely, yeah. So that's what our practice is. Yeah, we do acupuncture points into meridians, but and into the Chinese medicine points. But what you'll notice, it's so interesting if you actually look at a map of the meridians, and you superimposed it on the fascial map, it's like exactly the same, very similar. So I think there's definitely something to be said for that. We do anatomical needling and meridian needling, but to be honest, there's a lot of overlap on those points, but it's really cool. Those maps for sure are similar.
So there's some crosstalk going on there that we know about.
Yeah.
You say anatomical needling. Is that like dry needling?
Yeah, exactly.
Okay, so it's a little bit deeper than the acupuncture.
You got it, yeah.
Yeah, my favorite. Just kidding.
Yeah.
My buddy Jeff LeCoven, who's been on the show before too, he has worked on my elbow and my shoulder, and what's interesting is like if you have like elbow pain, it's really like referred pain from like low back and all this, so it's all this fascia.
Everything, so that's really, that's brilliant. Like someone might come in my practice and say my wrist is hurting, and I might work just on their neck and their upper back, and they're like, do you remember that my wrist, that's why I came here?
They're like, hello, I came in for my wrist.
And then I'll go, now move your wrist, and they're like, oh my God, you didn't even touch my wrist, right? So it's really important in that sense to find root cause, just as it is in functional medicine, because if you don't find kind of what's, where is this originating, then you're going to, as we spoke about before with the other practitioners, you're going to microscope and your wrist, let's do wrist exercises, let's tape your wrist, let's like work on your wrist. Yeah, exactly, right. Let's take a picture of it, let's take an x-ray, right? Yeah. So we need to understand that this, everything is connected. Yeah,
the wrist is, believe it or not, connected to the neck at some level.
Exactly, yeah.
That is awesome, really funny stuff. So Shalini, let's kind of dive into your personal, kind of story and journey there, and start with your morning routine. This is something we like to ask every guest on the show. So you have a busy practice downtown Toronto.
I do.
What does the first couple hours of your day look like?
If I had a couple hours, I would love it. Yeah. It's usually, I wake up, and I actually, for the last shy of a year, have been saying to myself, I watched this on some show, and it was an elder man, and he was saying to his wife, after I go, all you need to know is every day when you wake up, you have all you need. When you lift your head off the pillow, you have all you need. So I have this mantra every day when I wake up, and your mind starts racing, I gotta do this, I gotta do that, I go, okay, hold on, wait, I have all I need. And that's like one of the most simple things that I do in the morning that's actually calmed a lot of my own things, because really nothing matters if you don't wake up.
Right.
So you physically took your head off the pillow, that's awesome. Small celebration, then you start the day with a small celebration. And then, I just get ready and I try to have my tea while I kind of map out my day. I do some light stretching in the morning. And that's it. I'm lucky enough to be in a place where there's Pilates equipment. So I'm between patients, I'm doing my workout,
Very interesting. So starting the day with just a moment of like basic gratitude, right? And being very like grateful and aware that like what a blessing it is to wake up again.
Yeah. I think it's, we get, sometimes our gratitude is, what am I supposed to be grateful? Oh, okay, I'm glad I have a job and a roof over my head, and but let's get back to basics. You and I were talking about it, right? Like you lift your head off the pillow. Oh wait, that is all I need to do today. Like that's all I need to get through today, right?
Yeah, some people don't do that.
Yeah.
Right, very, very powerful. Yeah, that's a consistent theme throughout, like anyone I talk to is like being very grateful in the morning, and so starting that with like that mindset of being grateful for just that, then you're grateful for other things, like you made it to work on time, then you have running water, and then it just creates this like aura of being very appreciative, which is really cool. Let's talk about breakfast. And in Ayurvedic medicine, I know a lot of practitioners in India love like lunch is like a big meal, right? So do you skip breakfast? Do you have a little breakfast?
I alternate between, so it's funny you and I are talking about the keto thing. I actually make a rooibos tea, and then I do ghee in it, so I make it sort of...
I'm going to point to the ghee while you're talking, we just made it.
Yeah, exactly.
Yeah.
And if I'm not the biggest fan of eating in the morning, first thing, so if I have an early office, that's probably all that I'll have, and I'll head to the office. If my office starts a bit later, like 9:30 or 10, I'll definitely have a protein shake in the morning. Okay. So I don't really eat in the morning per se. Otherwise.
You're not a breakfast person.
I mean, no, I definitely have a shake, but you know, if on the weekend, then I love cooking, I'll make all kinds of things, but on the weekdays, it's usually just a shake or a butter tea.
I see. And then, so is lunch kind of the biggest meal of your day, or?
Not really. I'll make a salad usually every day, and a piece of protein and get good fat on it, and then at night is where I cook, and that's probably my biggest meal, only because of time. If it was my choice, I would make lunch my biggest meal for sure, and then a lighter dinner. That's how I do best, but just because of
lifestyle, working with patients is not feasible, right?
Yeah, especially because I'm working manually on patients. I don't want to be too full. So I'll be eating a light lunch. I might have a light little something afterwards. Yeah. That
makes sense. You know, if you do have a big meal, you kind of want to nap, right? And so it can become a little challenging.
Or sit down, which I don't sit down. My work is mostly up or chatting with people or working. So.
And you really can't be tired, because that patients will know, you know, like, hey, last time you were really deep, and now it's like, what's going on here? So we refer to the ghee. I just want to let people know, if you're watching this, click the link below this video where you can watch the demonstration, and if you can also Google your name on YouTube, and the ghee video will pop up if people are listening to it. Okay, so favorite herb, botanical nutrient. So you're going to be stranded on a desert island. Vitamin D, omega-3s are covered. What are you bringing with you?
Ooh, good one. Okay, and coconut's covered?
Coconut's covered.
Okay. Oh, good question. I guess I can't bring a probiotic, can I?
No, you can bring, probiotics, so that would be number one, hey?
Yeah, I would probably bring a probiotic, Actually, I'd probably bring an antimicrobial, but then I was thinking the coconut, so probably bring a probiotic.
Awesome, really good stuff. So if you're trapped in an elevator with president of the US or someone from Canada or the World Health Organization, what sort of lifestyle or health tip are you going to share with them?
I think that one of the biggest problems in our healthcare system is, again, that zooming in, right, and piecing everything apart. And I don't know how it can change, because I'm not sure at what level it gets changed, but think of how powerful, I mean, here in Ontario, you know, we have healthcare, right? And it's really kind of sick care. So we can go to the doctor for free, but no, you cannot go to the doctor and be like, I want to be well. They would sort of be like, I don't know, read Canada's food guide. I don't know what you want me to say to you.
Well, we don't have, that's not.
Yeah. So I think we should all be shifting our perspective to trying to create a healthcare system that creates health and creates wellness and vitality, and being able to imagine you could have functional medicine tests, you know, ran for you every single year, instead of going to your yearly physical where they do like a couple serum tests and they say, yeah, you're fine, Kate, you know, see you next year. There's nothing preventative. There's nothing empowering for people out there to say, hey, guess what? You can better your health. So I think, you know, at least telling them, you know, maybe let's try to shift this model backwards, so at least we can start getting people in the prevention phase.
That's beautiful.
Because a lot of people don't know that, and when they do hear that, they're like, why doesn't our healthcare system have all this stuff? You know?
Right. Very interesting. And just the appreciation that vitality and wellness, like looking at that as though it's a metric of overall, you know, well-being, and so it's not really appreciated. It's like, oh, you don't have any medicines, you're over 55. Oh, you're totally healthy. Like I hear a lot of adults say that. Like I'm on no drugs. It's like, well, okay, that's cool. You're better than the majority of the sick people out there, but that doesn't really mean that you're totally vital. So bringing up this conversation that vitality is a metric of overall well-being.
Yeah, for sure.
Absolutely. So Dr. Shalini Bhat, thanks so much for coming on the show. If folks want to learn more about your work, how can they do that? Yeah, they can follow me on Instagram. It's at dr.shalini-bhat, or you can follow us at The Movement Boutique. Our website is themovementboutique.ca,
and that's where we're at.
Fantastic. Well, folks, thanks so much for tuning into this video. If you liked it, please give it a thumbs up and subscribe to the channel. I'll put the show notes below in the description and also the link to the key video. So as always, I appreciate you tuning in and hope you have a great day.